Morning, madam.
Okay, today I'm Rohaini binti Baharudin. We're teaching you about proper donning and doffing in PPE. You know what the PPE?
Yes.
Okay, let's see. First, learning objective. Define PPE and identify those relevant to the safety for healthcare personnel. Number 2, explain the regulatory role of the FDA as it related to medical device and the rationale for the classification of medical device, example like PPE. Number 3, demonstrate the step to follow for putting on and safety removing PPE. So this is the picture show that the full PPE required. So, what personal protective equipment? PPE. Personal protective equipment PPE refer to protective clothing, helmets, gloves, face shield, goggle, face mask, and or respirator or other equipment designed to protect the wearer from the injury of the spread of infection or illness. Number 2. Effective use of PPE include properly removing and disposing of contaminated PPE to prevent exposing both the wearer and the other people to infection. So this is the picture show what should have for the PPE and then how to dispose. So example, this is a face mask, gown, glove, and all this one need to dispose in yellow bag. So what is the type of PPE? Are you know?
Yes.
Okay, I think you know, but I will brief clearly what the type of PPE that used in healthcare setting. First, glove. Glove mean for protect your hand, gown to protect your skin and or clothing. Mask and respirator protect mouth and nose. Goggle protect your eye. And face shield protect face, nose, mouth and eye. So what factor influencing that we need to use PPE or selection? First, type of exposure anticipated. That means splash or spray versus touch, category of isolation precaution, and also durability and appropriateness for the task, and also the PPE. So I will explain you about what is the proper PPE and then what should you do. So first is hand hygiene. You know hand hygiene?
Yes.
Hand hygiene is a general term that applies to any one of the following. First, hand washing with plain soap and water. Antiseptic hand wash. That means soap containing antiseptic agent. And then antiseptic hand rub, alcohol base, and surgical hand antiseptic. That means perform as pre-operatively. That means you know this picture. This is alcohol base and this is soap lah. So number 2 is mask. Mask is a term that apply used to cover the nose and mouth and include both procedure mask and surgical mask. That means got two type, surgical mask and the actual mask. And then also covering for the nose and mouth that is intended use for general patient care situation. This mask generally attached to face with yellow and also tie or elastic. Okay, we move the next slide. So this slide show how to properly wear the mask. So the mask, the metal nose with piece in the top. That means here, right? Got tip metal. The white or smoother side is on the inside again, the wearer's skin color away face out. See? The color face out, then the white inside. The brit fall downward and away from the nose. This one.
Ke bawah.
Okay. Okay, now going to respirator. Respirator, protective device worn by healthcare personnel to protect them for inhalation, exposure to airborne and infection agent. This one, are you familiar for this?
Yes.
Okay. Call and notify, example. So identify is a disposable particulate air purifying used most commonly personal healthcare, and also we have N100. By the way, is our in hospital we use N95 in this hospital setting. So now going to Google this one. Fitting eye protection that completely cover the eye socket and the facial area immediately surrounding eye and provide protection from impact, dust and splash. Okay. Now face shield. That now you already wear it. So transparent sheet of plastic extend from eyebrow to below the chin across the entire width of the employee head. The face shield protect against nonsense, dust and potential splash or spray of the hazardous liquid, but will not provide adequate protection against impact hazard. Mean you need to wear proper, like the picture. That mean on the head. So glove. Glove normally made of polymer or provide protection from chlorinated solvents such as trichloroethylene and trichloroethylene. It means they are protect with all greases, acid, caustic, and alcohol, but are generally not recommended for use with strong oxidizing agent, aromatic solvent, ketone, and acetone. Example, glove is this one. Okay. Okay, you know what the fact about glove? Remember, glove do not prevent of needle stick or sharp injury, but study have demonstrated that the transmission of the blood-borne pathogen may be significantly reduced due to the cleaning effect the material of the glove has on the instrument as it passed through the glove. That means whatever we wear the glove, wherever the blood, that means not through your hand, that means your skin. The glove will protect everything. And then also prolonged and indiscriminated use the glove should be avoided as the may cause adverse reaction and skin sensitive. I mean sometimes prolonged wearing the glove, you can get some adverse reaction like maybe itchy or skin problem. Okay, now going to slide. This one slide show is gown. That means fluid resistant gown got two to protect clothing tested against water as the liquid challenge. And then this is impermeable gown material that have demonstrated blockage of micro using a recognized standard test method. That means got two. Now this one I show you is the first one lah we wear, we use. The other one is the blue gown. This is surgical gown, different for other gown that I teach you, inform you. For the surgical gown, rate for high level barrier protection may include the high performance barrier material is only certain portion of the gown. That means sleeve and front panel. This important when contact for hazardous or contaminated fluid can come from the multiple direction. That means not in front, sometimes beside or behind, because cover full. And then normally used for the pre-operative, that means in OT, operation theatre. Also, fact about gown or apron. Gown and apron should be removed in a manner that prevent contamination of the wearer clothing or skin. The outer contaminated side of the gown should be turned inward and rolled into a bundle and then discarded into designated container for the waste linen to contain contamination. Are you understand? Okay, thank you. Okay, this I show like personal PPE card. That means the box or the card that normally used. By the way, for our Malaysian country, so far you know, only you aware for this card only. By the way, the overseas we got multiple card. That means multiple box, multiple dustbin. So this normally used in overseas. Got drawer, and also same. Got another color of linen. But normally is our country use yellow bin. That means yellow color for the discard everything, the infection cases or infection. That means PPE that we need to throw it. So now I will teach you about the proper donning of PPE. First, you need to keep hand away from the face, limit surface touch, chin when torn or heavily contaminated, and work from clean to dirty. And then first, you need to hand hygiene. You know, we have a step for the hand hygiene. I will demo you after that, after this. Number 2, we need to gowning. First, fully cover torso from neck to knee, arm to the wrist, wrap and around back. Fasten in the back or neck and wrist. That means from start we tighten the neck, the back, sometimes got the wrist also. Number 3, mask or aspirator. Secure tight or elastic band of the middle of the head and the neck. See the picture, the step. Either you use the yellow or tight behind. Fit flexible band to nose bridge. Yang that I show you got bridge here, so you need to fringe. Fit snug to face and below chin. That means for the nose below chin. And fit, and also you need to check the how you aspirator. Number 4, goggle or face shield. Place over the face and eye and adjust to the feet. Anti-fog feature improve the clarity. See how you need to do how from the top. Not this one, it's a wrong. And then this also, you know the different. Yes, this one no mask. This one is facial, yeah, mask. 5 is glove. Glove extend to cover wrist of isolation gown. So after you donate, you need to doffing. That means throw everything your PPE. So now we do proper doffing of PPE. Okay, first you need to remove your glove. That means outside of a glove are contaminated. That means the glove, the outside already contaminated and also dirty. So if your hand contaminated with glove remover, immediately wash your hand or wipe with alcohol based hand sanitizer. Use a glove hand, grab the palm area of the other glove hand and peel off first glove. Hold remove glove in glove hand. Slide finger unglove, hand under, remaining glove at wrist, and peel off second glove over first glove. And then also discard glove in the waste container. container. This is a slide show that the proper removing of glove. First, pinch and hold the outside of the glove near the wear area. Peel downward away from the wrist, turning the glove inside out, and then pull the glove away until it is removed from the hand, holding the inside out glove with the glove hand. Number 6 is Number 4, with your ungloved hand, slide your finger under the wrist of the remaining glove. Do not touch, remember, do not touch the outer surface of the glove. Number 5, peel downward away from the wrist, turning of the glove inside out. And the last one, continue to pull up the glove down and over the inside out glove. Bring help on your glove hand, totally out. For the gown, also same, gown front and sleeve also contaminated. So same, if your hand contaminated with during gown removal, immediately wash your hand or wipe with alcohol-based hand sanitizer. Unfasten gown tie, taking care that sleeve don't your body and reaching the tie. Pull gown away the neck from neck and shoulder inside the gown only. Turn gown inside out and pull or roll into the bundle and discard in waste container. This step need to follow. Goggle or face shield, also same. All the outside goggle or face shield are contaminated. If your hand contaminated also during goggle removal, immediately wash your hand or wipe with alcohol-based hand sanitizer. Remove goggle or face shield from back by lifting headband or earpiece. Discard in waste also container. Mask or respirator, also same. Inform mask or protector, respirator also do not touch because it's all contaminated. So grab bottom tie or elastic of the mask or respirator, then the one of the top, and remove without touching the front. Also same, discard in waste container. Again, hand hygiene after all you removal. So now I will show you the video how to do the proper running on your feet.
To reduce risk of transmission, ensure hair is pulled back and jewelry is removed or minimized. For enhanced airborne droplet contact precautions, start by performing hand hygiene for 15 to 20 seconds. Rub palms, wrists, in between fingers and thumbs, back of hands, and along the nail beds. Alcohol-based sanitizer is the preferred method. Use soap and water. Tie the waist, ensuring all clothing is covered. Place your fit-tested N95 mask over your nose and under your chin. Place the top strap at the crown of your head. Stretch the bottom strap over your head to the back of your neck. Hold the nose strip to ensure a secure fit and tight seal. Without touching the mask, perform a seal check by placing your hands at the top and bottom while taking deep breaths to feel if any air escapes. If air is felt, readjust mask for proper seal. Don face shield by placing strap at the back of the head, ensuring the shield is resting in the middle of your forehead. Put on gloves one at a time, making sure they are snug over your gown and no skin is exposed. When entering a negative pressure room, ensure each door is securely closed behind you. When doffing your PPE, step into the anteroom, ensuring the door is first glove by pulling it up and away from the middle of your palm, ensuring no skin contact. Hold glove in the other hand. To remove the second glove, place a finger inside the clean area of the glove and push it off, balling up both gloves together. Throw into the garbage. Remove your gown by first opening at the neck and then at the waist. From the back of the neck, take the gown and slowly pull it out and away from you. Ensure you are only touching the inside of the gown as you roll into a ball and then throw into the garbage. Perform hand hygiene for 15 to 20 seconds. Remove the face shield by leaning forward, pulling the strap forward and away from you. Place into the garbage. Remove N95 mask without touching the exterior part of the mask. Again, pull it forward and away from you by starting with the bottom strap and then the top. Place it into the garbage. Perform hand hygiene again. For droplet contact precautions, a procedure mask is required. Follow the same donning procedure for the hand hygiene, gowning, and glove placement. For the procedure mask, place elastics around ears, form to the bridge of the nose, and pull under the chin. Follow the same doffing procedures by removing gloves one at a time using the glove-to-glove, skin-to-skin technique. Remove your gown by opening at the neck and then the waist. From the back of the neck, take the gown and slowly pull it out and away from you. Ensure you are only touching the inside of the gown as you roll into a ball and then place it.
Okay, already show. So after this, I will do the demonstration. By the way, any question? Okay, yes?
How the PPE is stored?
Okay. Normally, the PPE should be stored if in dry area at room temperature, protected from the dust and moisture. And also, we need to check with the manufacturer for more specific storage condition. And also, some item maybe have expired date and require 2 rotation of the stock to avoid outdating. Thank you for the question. Another question? Okay, Ken?
What is PPE is used if both airborne and contact are needed, such as for SARS and avian influenza?
Okay, normally from the PPE that we need to use, if airborne or contact precaution like SARS or any avian influenza, we have a NIOS certificate. Fit tested is N95, filtering piece or PAPR, gown and NIOS. That means everything the PPE we need have a NIOS certificate. Also, we need to protect also same like what I teach you, eye protection and face shield during patient contact. I will ask you about what I teach you just now. I hope you can give me the refer what I asked for the question. So now, who can list me about the sequence of donning? Yes.
Energy,
Yes.
Downing,
Yes.
Combat, Patient, Glove.
Okay, thank you. The last one, anybody can answer me the list sequence of doffing. Okay, yes, thank you.
Remove glove,
Yes,
remove gown, hand
yes,
hygiene,
yes,
remove goggle,
yes.
remove mask, and hand hygiene.
Okay, thank you. So I hope whatever I explain to you, I teach you, will benefit for you, because now is a COVID-19 pandemic. So all the procedure like now we have endoscopy, need to wear all PPE. So thank you for the listening, and now we go for the demonstration. Use now is either hand sanitizer or use soap,
Water-based.
water-based or soap. So first, you use palm to palm, little finger, and back. Okay, thumb. Make sure everything dry. So now we go make. So how you go make? Now this one. And then if you cannot do alone, you can have assistant. So you need to fasten everything. And then we use mask. So mask, make sure you tie behind. So when you wear your mask, you need tighten the tie properly, and then make sure the metal need to pinch, and the mask cover all your face and chin. So now, Google, either you use this one, also must cover full, or you can use face shield. Also same, face shield you need to have through straight away from the behind the head and adjust to the
eyebrow.
yeah. And then the last look. So now ready for you all to do whatever procedure in your unit. So now for the dolphin. So dolphin, so make sure don't touch. And then go. So this is a dustbin or container that we need to have. Okay, after that, what you need to do?
Remove the
Gown. Okay, how you remove the gown? You just peel out. This one don't touch, right?
Yes.
Make sure in front don't touch. So you pull, you roll. And also same. And then after that, can I give? So same, can I give? Then after this,
Remove the shield from the
How?
back.
then this one. So same, throw. And then the last one.
Face mask.
This one also same. Also same, don't touch the outer layer.
Okay.
Hand hygiene again. So Clear?
Yeah.
So I need one person to do that. Okay, thank you for everyone for the participate on the lecture and also demonstrate for the PPE, how to proper donning and roughing. Thank you very much.
Okay, thank you very
Welcome.
much.